Hi, I'm Amy McCarter. Welcome to House Calls brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Vance Lassie of Holton about tonsillitis. Thanks for being here today.
Thanks for having me.
What is tonsillitis?
Tonsillitis is inflammation of the tonsils. Often when we talk about tonsillitis, we talk about pharyngitis, which is just sort of a sore throat. Usually when you're talking about tonsillitis only, it's just infection of the tonsils. Can be bacterial, can be viral.
How do you get it?
Usually in the same way a cold, you get a cold just from hanging out with sick people or eating or drinking after them or something like that.
Can it be prevented?
If you avoid those things that, don't eat after someone who's sick or drink, that kind of thing. Wash your hands a lot.
How's it usually treated?
It's usually treated with antibiotics if it's caused by the bacteria. So we get a lot of strep throat, and that type of tonsillitis does require antibiotics most of the time, but sometimes there are exceptions. Sometimes those antibiotics would be a shot, sometimes they'll be pills. It kind of depends on the clinical scenario that your doctor would choose to think about.
Okay, and at what point should you ever call your doctor?
When tonsillitis gets bad, especially in kids, sometimes they'll really have a hard time breathing. They'll sort of snore. Some folks, children and adults, can get an abscess, really big swelling in the back of the throat. When those things happen, you'll know because they really hurt. But sometimes you kind of look in the back of your kid's throat. Or you might look in your own throat in the mirror with the flashlight, and it can be real red and dangerous looking. You just go, that just doesn't look right. Never a bad idea in a circumstance like that to talk to your doctor. Now, that doesn't mean it's bacterial. Sometimes they're still viral, and there may not be a treatment other than, gargle and wait it out.
Okay, all right, good information. Thanks for being here today.
Yeah, thank you.
Please join us next week for a new health topic discussion on House Calls.